Hello, Dr. Glassman.
Man. Shaun, you might try knocking next time, although, you know, that might be a little tough.
What are you looking for?
Oh, you know, my life. It's just my life.
I will miss your big screen LED TV.
It was old. We got a pixel line down the right side.
Did you love Alana?
What? Did I love Alana? Yeah, of course.
Did you love Debbie?
Yeah, I love Debbie. Where is this going, Shaun?
That wasn't enough for you to get over your differences. How do I know if love will be enough for me and Lea to get over our differences?
Well, you won't know. I mean, how can you know? You can't know.
I do not like worrying about this.
Well, look, I mean, Lea had some doubts a little while ago, right? You both got over that?
Yes, because I was very supportive.
Okay, well, there you go.
But differences about child raising seem to be bigger than normal differences.
Well, yeah. I mean, having a child, I mean, that's big. That's huge. It's a shift. It shifts everything. Marriage, everything.
I do not want a shift in our marriage.
Well, maybe it'll shift for the better. Artie's eye. First thing I ever bought Maddie was a stuffed aardvark. Back in the day, I performed a 21-hour surgery. I removed an astrocytoma from the medulla of the brainstem. It was heroic. It put me on the map. My elective surgeries were booked out for a year. I was in a zone, like playing scratch golf. And then Ilana got pregnant. She didn't want to stop working. She had a real estate thing. She was doing very well. I didn't want to stop working. I wanted to stay on the map. And then we brought Maddie home that first night. Everything changed. Go talk to Lea.
I tried. She had to run a beta test on new EMR software.
Well, then you'll have to wait until she's done.
Don't you think it's time to come home?
No.
In that case, I wanted to make you something delicious like you've made us, but I'm not a very good cook and everything's closed. So, I hope you like hot dog flavored potato chips and Nutty Buddies. Yeah. Nail polish?
Father-daughter time. Maddie insisted that she paint my fingernails a sparkly rainbow color. The next day, my first patient was very uncomfortable. That's when I realized I forgot to remove the nail polish.
It's a nice memory.
Oh, sit. No, sit. So many memories. At Halloween, Maddie wanted to go as a ham because we had just seen To Kill a Mockingbird. But she wanted the ham to be made out of an actual ham. And then one night the wind was blowing so hard it blew her bedroom door shut. She was convinced that her grandmother's ghost had come back to visit her. Wanted to sleep in our bed for the next 2 weeks. You didn't come here just to feed me junk food, did you?
I thought you might need someone to talk to.
I'm fine. I know someone you should talk to.
I know. But this was easier.
Hot dog should not be a flavor.
Nathan, what's your puppy's name?
Patches.
Can I look into Patch's eyes with this little light? Make sure he's okay? Or you can do it. Just look in here.
Can you pick this back up and give it to the doctor?
I can't. Where's Daddy?
Can you give me a high five, bud? Good. Now, high 10.
What's happening? Is this a concussion?
It's not a concussion. Your son is having a stroke.
Starting the imaging?
Thanks. Nathan, you're about to hear some banging. It's just a machine. But remember to stay really still, okay?
I am.
Try a little harder, okay, bud? Motion artifact. We might have to sedate him.
Those are not artifacts. He does not have CNS vasculitis. He has Moya disease.
What the heck is that?
A narrow carotid artery is reducing blood flow to his brain. This area here looks like a puff of smoke. That's what Moya means in Japanese. A bunch of new tiny vessels have developed to circumvent the blockage. But because the vessels are abnormal, they're prone to bleeds.
We can fix the problem with a very interesting brain surgery.
Well, so now that you're done poisoning our son with chemo that he didn't need, we should trust you to crack open his skull.
We will use a small craniotomy to access...
I get why you're frustrated. Moya is rare and notoriously hard to diagnose. Many kids get chemo they don't need for a lot longer. We're hoping to do Nathan's first brain surgery tomorrow.
This STA anatomy is ideal as a donor vessel to bypass the blockage.
So we'll reroute the scalp vessel into the brain here. Gonna give you a little tip. Next time a child asks if you could do surgery on a stuffed animal so that he feels less scared, say yes.
I was only telling him the truth. Oh, this branch of the middle cerebral artery looks like an ideal recipient.
You're about to be a father. Children are illogical. And we can place temporary clips for vascular control and then anastomose the STA to the MCA using 10-prolines.
I was very logical as a child. I did not like being talked to like I was dumb, and I definitely did not like being lied to.
That child there felt that if his Dalmatian went through this scary thing with him, he'd be less scared. If you can embrace another person's thought process, it can strengthen the relationship.
Leah thinks she should not have to pee in the tub, which I understand. ICG angio looks great. Dr. Powers, you may do the dural closure, then replace the skull flap.
Before we close, we're almost a full hour ahead of schedule. Why not go ahead with the bypass in his other hemisphere?
That is not the plan. Simultaneous bilateral surgery risks altering brain flow too much. It could cause another bleed.
But maybe there's a way to reduce that risk. The wait for the follow-up surgery will be hell on the parents, the whole time knowing their son's brain.
The parent stress is not medically relevant.
I know, Shaun, but please. Can you think of any other way?
An encephalodural arteriosyangiosis of the left side would be relatively low risk. We could safely do that now.
Thank you. Rick, Linda. The surgery went well.